You've talked about how men with prostate cancer tend to deal with their illness differently than women with breast cancer, and how one deals with this sort of illness has great implications for their well being. Can you expand on that for us?
Well, we start with the basic premise that men are sure different than women, especially when it comes to dealing with a life-altering disease like cancer. I think one basic reality is that women have had to deal with their bodies since menstruation began in their childhood. We guys, on the other hand, have been pretty much able to ignore our bodies until middle or late middle age when things start breaking down. So I think as a result, we tend to be less comfortable in dealing with body issues, especially when it's cancer and especially when it's down there, as is the case, obviously, of prostate cancer. And I think that we boomers who've been talking about sex, drugs, and rock and roll since the 1960s are probably going to be somewhat less reticent to discuss this cancer than our fathers. That's certainly a good trend. But in the end, men approach disease very differently than women. Also, I think there's the other skill that women have inherently that helps them cope with disease better than guys. And that's women's almost innate ability to network with their family, with their friends, even organizations, begin grassroots movements, if you will, which is how the breast cancer trend began. And a woman is much more likely to go out and seek advice and support of her friends, especially when coping with a disease like cancer. I think we guys, on the other hand, have been socialized, and I do think, as I've said, it's also our natural instinct to be a man and solve the problem on our own. Going to our friends for advice or support can often be seen as being unmanly. And I know guys who've gone through treatment without even telling their families, which is, by the way, particularly unfair to their sons who are obviously at greater risk to get the cancer themselves. So I think that the difference in guys keeping things to ourselves or women being more open and talking and sharing is one big reason why we see more pink ribbons in October for breast cancer awareness, but we see almost no light blue ribbons, the color for prostate cancer, in September, which is Prostate Cancer Awareness Month, even though as many men are diagnosed each year with prostate cancer as women are with breast cancer. But in the end, I think what's most important is that whether you're a woman or a man, cancer of any kind is not a journey to be made alone. Our family, our friends, our communities, such as our churches, are invaluable companions. And I really believe that they'll make the journey far less traumatic than if we try to just be tough and do it on our own. And that's especially important when it comes to our spouses and partners. In a sense, we men need to man up and admit our fears and reach out to those who come alongside us for this journey.